The United States has the highest number of COVID-19 cases and deaths in the world, with over 28 million cases and over 400,000 deaths as of early February 2021. But not everyone in the US has been impacted the same way. As a matter of fact, the pandemic has brought to light the racial disparities in healthcare. Since the virus hit last winter, Black, Indigenous, and people of color communities have been disproportionately affected. According to the CDC, Black, Latinx, and Indigenous Americans are 1.1 to 1.9 times likelier to be infected with COVID-19 than white Americans, and Black people have died at 1.4 times the rate of white people, according to the Atlantic's COVID tracking project. As we continue to navigate through the pandemic, it's important to be mindful of these more vulnerable communities at risk. A genetic condition or predisposition doesn't account for those disproportionate numbers. The reasons are social and economic factors. For instance, those who work jobs outside of their home without paid sick leave are at a higher risk, which is a reality that people of color experience more than white Americans, according to the ACLU. Other systemic factors include higher demand but fewer resources and less access at COVID testing sites in neighborhoods of color, according to ABC News. But COVID isn't the only illness or condition that disproportionately affects communities of color. Maternal mortality, high blood pressure, and heart disease are just 3 of the many health conditions that had kept Black life expectancy rates years below that of white Americans. And while this information isn't new, COVID has prompted the media, medical practitioners, and public health experts to more aggressively focus on finding solutions. As the pandemic enters its second calendar year, more is happening to protect Black and brown people, not only from COVID, but from all race-based health disparities. The CDC defines health disparities as, quote, preventable differences in the burden of disease, injury, violence, or opportunities to achieve optimal health that are experienced by socially disadvantaged populations. The key word here is preventable, and as a growing number of medical experts argue, certain steps can be taken to reduce these disparities. In January, President Joe Biden made a historic appointment when he tapped Marcella Nunez-Smith, MD, an associate professor of internal medicine, public health, and management at Yale University, to co-chair the COVID-19 Transition Advisory Board and lead a new White House task force dedicated to health equity. The group was inspired when Kamala Harris first introduced the legislation to the Senate in April 2020. It's initially focused on bringing medical care to communities hit hardest by COVID, including an effective vaccine rollout. But when the pandemic ends, it will become the Infectious Disease Racial Disparities Task Force. According to a fact sheet from Harris on the legislation, it will, quote, identify and address racial and ethnic disparities in our healthcare system and improve future infectious disease response. In Milwaukee, a Black resident's life expectancy is, on average, 14 years shorter than that of a white resident. In response, the city became the first in the U.S. to label racism a public health threat in 2019. The declaration put racism in the same category as smoking or air pollution, as it too has the capacity to shorten lifespans. The category change led county officials to develop a racial equity budget tool that requires departments to detail how their budgets affect communities of color. In addition, training programs across municipal departments were established so employees can better understand how racism impacts public health. Since 2019, about 150 states, cities, and counties had joined Milwaukee. This includes Chicago, which hired a chief sustainability officer to prioritize the city's racial equity goals with its climate goals in 2020. In July 2020, DeKalb County became the first county in Georgia to make the declaration and pledged racial equity training for county employees, policies that center communities of color, and a future study that will help to clarify additional steps. To top it off, Massachusetts Representative Ayanna Pressley brought the issue to the national stage in September when she introduced the Anti-Racism in Public Health Act. The bill would create the National Center for Anti-Racism at the Centers for Disease Control and Prevention. Last summer, thousands of Americans took to the street to protest in support of Black Lives Matter following the police killing of George Floyd. This alone showed that even after centuries of racism, people, regardless of race, could recognize that race-based inequality exists, wanting to use their voices to demand change. This kind of change can be achieved by voting, joining community boards, and attending town council meetings. The public can also help by supporting local organizations and religious centers that partner with medical providers to assist communities. In Los Angeles County, there are more than 50 Black barbershops that offer blood pressure testing for customers. Churches are another place where community outreach can happen. Throughout the United States, Black churches have been hosting mental health experts during the pandemic to talk about depression and coping strategies with their congregations. Supporting local organizations like these can include everything from giving them your business and monetary donations to keep these programs going. A recent poll by the Kaiser Family Foundation and ESPN's The Undefeated found that only 6 in 10 Black adults trust doctors to do what is right, compared with 8 in 10 white respondents. And 1 in 5 of the Black people polled said they were treated unfairly because of race in a medical situation in the past year. Because of this, many seek doctors of their own race. According to Dr. Venus Wilder, quote, "The assumption is that their experience in the world is similar to your own. Not having to explain yourself, your culture, or your beliefs to someone is in many ways priceless. There's already a synergy that builds trust, and patients are more likely to reveal information they wouldn't have to someone they don't trust. It helps on many different levels with overall outcomes." According to the Association of American Medical Colleges, in 2018, white doctors make up 56% of physicians in the United States, Asian doctors comprise 17%, Latinx are 6%, and Black are 5%. Today, medical schools across the nation have been actively working to recruit a more diverse student body and faculty in hopes to change these numbers. The AAMC reported increases of more than 8% in Black, Latinx, and Native American first-year medical students in 2020. As we approach the first anniversary since the pandemic started, there's still a lot more work to do. But with the backing of the White House and the awareness of experts and physicians across the nation, reducing race-based disparities appears to have taken a top spot on the new public health agenda.